Thanks, Mary. All right, so it's time to get started. This is the third of a series of 3 sessions to teach you how to learn to identify TCM patterns. And then I'm also going to give you a brief introduction to some acupuncture points that might be useful for your own pets or your patients if you're in the veterinary profession that you can use. Can everybody see and hear me okay and see my screen? Everything's working for you? Okay, beautiful. So
yes.
Great, thanks. So we will go ahead and get started. So what we're going to be doing tonight or this morning for Deb is we're going to take the things that we learned in the first 2 sessions, and then we're going to use them and apply them to 2 sample cases. And then if anybody has a pet or a case that you wanted to share, we could have that, do that as a discussion. I'll see if I can use the whiteboard, which I've never done before. And then when we're done there, I'll show you a set of 6 pretty useful acupuncture points. So last week, we had 2 sessions. One was on identifying a TCM pattern, and the first session was looking at different TCVM, treatment principles. We looked at the 8 principles. We looked at the Zong Fu organs. We reviewed 5-element theory. We had a pretty good look at yin and yang and qi, the fundamental substances of Jing and blood and Shen and Jin-Ye, the thin body fluids, and then also the 6 evils, wind, dry, damp, and that. And so now that we have that knowledge, we're going to use those and incorporate them into recognizing TCM patterns on your patient. The second session was using the 10 questions and the 4 examinations using our senses of listening, smelling, touching, and looking. And then also we did quite a bit on looking at different tongues and the patterns that are associated with those. So what we're going to do tonight is we're going to take all of that and we're going to flesh it out a little bit, and we're going to add some Western or conventional information into our patient analysis. So we start with the signalment, and this is a pretty straightforward outline that we use a lot in the College of Integrative Veterinary Therapies in presenting our cases. The first thing we do is we start with the signalment, and the signalment is really just the age, the sex, the breed, and the species and the breed, for example. So say it's a 2-year-old male neutered German Shepherd. So you know that a young dog is going to have a certain set of problems and things versus an older patient, like a 16-year-old cat, is going to have a different set of problems. So age can be important. Breed, you know that, for example, Cavalier King Charles Spaniels are going to have heart problems and maybe some congenital malformations of their neck and the back of their head. So it kind of gives you a direction in which to go and kind of start your thinking about what there might be. There's always the current problem when you work in a practice. There's always a presenting complaint that people bring in, or something that you've identified in your own pet that is your main concern. And then the Western history, again, is going to use listening, and then the Western diagnosis. So the Western history is going to include medications, response to medications, any previous problems, anything like that in the history. And then the Western diagnosis is pretty straightforward. We're going to add to that our information from the 4 examinations using our 10 questions. And remember, the 10 questions really are kind of similar to the questions that you would ask in a conventional exam, but they're going to be looking for things more like odors, the character of the odors, colors, the character of the colors, size and shape of and color of skin flakes, for example, and also the environment that the animal is in, its background, its upbringing, any history of a trauma or things like that, because that can be really important when we're making a TCVM pattern identification. This is something that I touched on last week, but I wanted to go into it in a little bit more detail. This is it's called the horary clock, and it illustrates the flow of qi in the body on a 24-hour basis. So the qi starts at about 3 a.m. roughly in the lung meridian, and I'll show you meridians later when we look at the acupuncture points. But the energy starts at the lung meridian, it comes right out here, right in front of your shoulder on your chest, and then it circulates through the large intestine, goes to the stomach and the spleen, then the heart and small intestine, bladder, kidney, pericardium, triple burner, gallbladder, and liver. And then it goes through the governing vessel, which isn't in the horary clock, back to the lung channel. And the way that we use this information, for example, is if your pet wakes up at 2 o'clock in the morning and paces and is agitated, if you wake up in the morning at 1 or 2 o'clock and your mind is racing, or you have anxiety and you're thinking of things that you shouldn't really be thinking about, and you should be sleeping at 2 o'clock. Insomnia is a big one. That can involve liver pathology. Another one, for example, is what's called cockscrow diarrhea, or when an animal has diarrhea at the beginning of the day. That can indicate a deficiency in the stomach and the spleen. These are also the animals that really don't like to eat breakfast. And so they kind of will maybe pick their breakfast, but then as the day goes on and the energy exits the spleen and stomach, they get hungrier. And so they'll start eating later on in the day. So that's the way that we use this. And I thought that it would be a good thing to kind of look at, since I didn't really have time to add this into all of the other information that we looked at last week. So I'm going to present two case examples. And then if we have time, or if anyone has organized a case that they'd like to present and go through, we can do that. So let's start with case one. This outline is in your in the Google Doc file that I emailed earlier today. You've also got a picture of the horary clock to look at as well. So let's start with this. This is a 4-month, 4.5-year female spayed canine Kelpie. For those of you who may not be familiar with what a Kelpie is, it's an Australian sheep herding dog. They tend to be very driven. They're very high strung. They're very independent. They are bred to herd sheep and help sheep herders without really a lot of direction. And so they kind of take control and do their thing. Listening the history. So this dog presented for seizures. It had never had seizures before, but it had 3 seizures in the last week. Seemed to have the seizures when it was out in the yard during the day. And again, it had never had seizures before, but the owner had started using an electronic bark deterrent collar, like a shock collar, which immediately preceded the onset of the seizures. The owner, I think, was using that bark collar because the dog would stand and randomly bark at a corner of the fence. And he wasn't really sure if there was another dog over there, or if the dog was like barking at nothing. Blood tests, all of the conventional Western things were normal. The owner didn't want to pursue an MRI to look at the brain for something like a brain tumor. So the dog was not on any medications, had a normal appetite, but loses interest in his food. His food was a dry kibble from a Tractor Supply, kind of a feed store type of a store. So the Western diagnosis was idiopathic epilepsy. So idiopathic means we don't know. We do all of these tests and we don't really find a specific reason or what's called the etiology or cause for the problem. And so that's assigned a descriptor of idiopathic. So when we see the dog, it's agitated in the exam room, it's whining, it's unsettled. It's kind of like side-eyeing you and very wary as well. The coat appears dry with small white flakes, and the tongue is pale. This was a case that was adapted from one of the forum posts in the College of Integrative Veterinary Therapies. And the student didn't say if the tongue was pale and swollen and wet, or if it was pale and dry. So all that I really have to present is that it's pale. The dog doesn't like being touched, is very suspicious. If you've ever worked with Kelpies, that's pretty typical for this breed. And then on this particular case, there were not any odors that we appreciated. So this is how I learned and how I got started in taking all of the information from the exam and the 4 examinations and trying to organize it, because traditional Chinese veterinary medicine diagnosis and patterns, they're kind of multidimensional. They're not a real linear algorithm like Western medicine is used to presenting, and kind of the Western way of thinking. And so I had to make a list of all of the pertinent findings in a left-hand column. So we'll always take the breed and the signalment, for example. The seizures are recent onset, they are acute. The timing was in the yard during the day. Again, that might go back to looking at the Harari clock. There also was probably an association with the ultrasonic device, the bark collar, and then it barks randomly at a corner of the fence. The diet, I always add in information about the diet. And again, in this one, it was a dry kibble, and the appetite's inconsistent. So the Western diagnosis here is idiopathic epilepsy. Taking some information from our TCVM exam questions and our 10 questions, the dog is agitated and suspicious. So that's the personality of the dog. It doesn't like being touched. So it was a little bit hard to appreciate any warm or cold areas, any what are called active acupuncture points or anything like that. The fur was dry and it had small white flakes, and the tongue was pale. So now that we have our list of like our problem list or our findings, the next thing I do, and this is going to be a very busy slide, but TCM in my brain tends to be busy, so welcome. So what I do in the right-hand column is I make a list of the different TCM patterns that I might expect to see for each one of these items in the left-hand column. So the breed, again, the Kelpie, Kelpies can be prone to seizures. So that's a congenital, perhaps a kidney gene deficiency. Their personality, again, they're like, they don't like to put up with stuff. They don't like to be touched. They don't like to be bothered. They have a goal, and they tend to be a little bit irritable. And so that's going to be associated with the liver or the wood element. Acute onset, recent onset of seizures is a wind invasion. And I said a wind invasion, so that means that wind, remember we talked about the 6 evils. The wind is a pathogenic factor that will blow in and carry other pathogenic factors into the body. So the association with the ultrasonic device for me would be a wind invasion, and the pathogenic factor would also include dry. He stays in the yard during the day. I didn't really have anything that came to mind necessarily for that. Barking at a corner of the fence is kind of random. Is it a Shen disturbance? If the dog's blood deficient, remember the blood houses the Shen, which is your spirit. And so if you're blood deficient, your Shen doesn't have a residence in which to reside. And so it will be disturbed. The other thing that might be a factor here is phlegm. So remember, phlegm, I kind of hinted at it, has 2 forms: substantial, like fat or lipomas, or the things that we typically think of as what phlegm looks like. But there's also insubstantial, that doesn't have a physical form, but it obstructs function and blocks the channels. And so that can be one of the components of a Shen disturbance, is phlegm misting the mind. So I just kept it simple and put phlegm. The dry kibble diet, we talked about the effect of processed foods on the Shen, on the spleen qi deficiency or the digestive function. So that has to go here on the list. And then again, remember the sequelae of a spleen qi deficiency is it fails to transform and transport the qi, the gu qi from the food up to the upper jiao where blood is made. So you get a blood deficiency, but then you also get the accumulation of the pathogenic yin fluids as damp and then phlegm. Inconsistent appetite, anything that involves the appetite is usually going to involve the spleen. So the Western diagnosis was idiopathic epilepsy. this book I did not put in your, you probably like, I can put it in the notes later if you want, but there's a book by Wynn and Marsden that is really good because it's organized by organ systems. And then you can look in the organ systems, for example, neurology and epilepsy, and you can look at the different patterns and see which one of those fits your animal or your patient. So upward disturbance of wind phlegm, that's where this insubstantial phlegm is carried up because of a liver, blood, or kidney yin deficiency. So you have dryness and deficiency here. And so the way I think about this is when you have blood and yin deficiency and you have dryness, in my mind, I picture the desert where you have mud and then all the water evaporates off. And so you're just left with this sheet of dry dirt that has cracks in it. And if you've been in the desert in the summer when it's really hot, or maybe the winter in Australia when it's really hot, you'll see thermals and you'll see little kind of backwards tornadoes, if you will, of heat rising off of the surface. And so that is going to be wind, and that carries heat and it carries phlegm. The other main pattern for seizures is, again, involves the phlegm, but it's from the spleen qi deficiency, which generates phlegm and blood. Yes, I will put the name of the author into the group chat when I get to a little bit of a break. Thank you. So the agitation and suspicion of this dog, again, Shen disturbance, could be blood deficiency for the reasons that we talked about. It can involve phlegm, and it can also involve the liver qi stagnation. So liver blood deficiency, blood fails to nourish the qi stagnates, you get anger and irritability, anger outbursts and things like that. Doesn't like being touched, again, liver qi stagnation, blood and yin deficiency. The dry fur with small white flakes. So I wanted to make sure that you guys knew that there are the handouts in the Google Docs that have two documents in them that can be useful in going through and assigning these TCM patterns to the different exam attributes. One is the pattern differentiation document. That is a document that I borrowed from the College of Integrative Veterinary Therapies, and it's a nice kind of a table that you can use. And then the other one was the one that I made that's called Identify the Pattern. So that's where I'm getting a lot of this information from, and that can be a really good resource for you. And so there you'll probably see dryness with small white flakes. So sometimes you'll see flakes and discharge, or flakes really in crusts that are kind of brown or gray, kind of big. Those are going to be more damp and damp heat. And that is different from a blood deficiency where you have dryness and you have dry fur because blood nourishes the hair follicles, and then the flakes are small and white. Thank you, Neil. So Neil posted the information on the book for the Manual of Natural Veterinary Medicine. Thanks, Neil. And then the pale tongue, again, since we don't really have any more descriptors for that, we just know that it's pale. If it's pale and dry, that's going to be blood deficiency. If it's pale and swollen and wet, that's going to be more of a qi deficiency. Does anyone have any questions about this? I know it's kind of a lot and it can be overwhelming at first, but this was really the best way that I had to organize my thoughts and to figure out kind of what's going on. Because if I don't do something like this, all of this kind of swirls around in my head and it's hard to get it settled and organized.
I like your system doing this. It makes really good sense to me. And I'm going to borrow this for future because it's a system to be able to really together and have one place to collect it all.
Sometimes I'm a little organized.
Well, I'm going to borrow it. So thank you.
All right, so here we have the Western diagnosis again, is idiopathic epilepsy. So let me just go back. So the way that I use this also is I look at all the things that I've listed, and that's why it's important in this right-hand column to put down all the possibilities, because what you're looking for here is you're looking for things that show up at least 3 to 5 times. So we've got liver, we've got wind, we've got liver down here, we've got liver, blood deficiency. Remember, the liver stores the blood. So definitely liver and blood deficiency are going to be on our list. Wind. The other thing I wanted to say about wind is the liver is really the source or the major source of internal wind, again, from dryness and generating that wind that carries heat and phlegm up. So here I put a wind invasion because it was acute onset of seizures and seemed to be associated with an outside device. But you may also have, from the blood and yin deficiency, the liver is generating internal wind. And so we talked about if you have internal deficiencies or internal excesses, when there's something that happens on the outside, that just exacerbates that, okay? So again, idiopathic epilepsy. And then the TCM pattern that I have ascribed is liver blood deficiency. I think there's internal wind from the dryness and the deficiency of liver blood. But I also think that that has made this dog susceptible to an invasion of wind dry. And then the underlying cause of the blood deficiency is going to be the spleen Qi deficiency in the diet. Okay? Does that make sense to everybody? Okay, cool. I see nodding heads. So we're going to do a second case. So did anyone have any questions before I go into the second case? Okay. So the second case here is a little bit different. It's a 5-year-old male neutered retriever. I believe the case, forum case post, it was a Labrador golden retriever mix, but a retriever is a retriever. Listening for the history, the presenting complaint was a skin rash and stinky ears, no surprise for a retriever. The itching was intense, which can be important, and he licks and chews at the stifles, which are the knees, and the groin. So that's the part of the abdomen back behind the hind legs. And the owners also noticed that he was shaking his head. It's worse in the spring and summer when it's hot. The dog's lethargic in the spring and summer when it's hot, but he's more active in the cooler months. Also drinks more water when it's hot. His diet's a dry kibble, and this dog loves to eat. He's a typical retriever. He's a couch potato. He's laid back. He's friendly. He likes everybody. He's very calm, and he is kind of a foodie. He loves to eat. He has been treated in the past for dermatitis, the skin rash, and otitis or ear infections, and it's responded very well to antibiotics and then topical antibiotic and anti-inflammatory medications. We talked about antibiotics are used for infection. Infections are damp heat, and so antibiotics neutralize that character because they are dry and cold. And same with the antibiotic and anti-inflammatory medications. So we can use a response to medications in the past to help supplement what our TCM pattern is going to be now. So moving on to the 4 examinations, we see that he's overweight, not uncommon for a retriever eating a dry food diet. His personality's laid back. He just kind of comes in, says hi in the exam room, and then plops down and kind of hangs out. When you look at the skin lesions, they're crusty and moist. The color of the skin lesions in the groin are red, and the ears are red. The owner also noted that the dog has kind of a general smell, but couldn't really describe what that was. And then you see that the tongue is swollen, red, and wet. When you touch the dog, his ears and the top of the head feel hot. The fur is dry. Remember, like in the last case, the fur was dry, but this time the skin feels really greasy. And you also notice that he has a smell that you can pinpoint to the ears. They have kind of a yeasty type of an odor. And then the teeth really don't have a lot of dental disease, but his breath doesn't smell nice and clean. It has kind of a bad breath or halitosis. Okay, so here we go. So here's our left-hand column. The breed's a retriever. His personality and his constitution, kind of laid back and easygoing and calm. We're looking at colors, red and hot, red skin lesions, intense itch. So all of that red and hot right there. The fur is dry, but the skin is greasy. He's overweight or fat. He's responded well to antibiotics and anti-inflammatory medications in the past. The problems are worse in the hotter month. He's lethargic in the heat, feels better in the cooler weather, loves to eat his processed kibble diet. There is yeast on the ear cytology, and he has a breath odor that really is hard to explain. And his tongue is red, swollen, and wet. So now we go over and we list all of our TCM patterns in the right-hand column, excuse me. So a retriever, anybody that's purebred is going to be kidney gene deficient just because of the fine-tuned genetics of purebred dogs. Retrievers tend to be gene deficient oftentimes, and they're almost always spleen chi deficient. They just seem to have a weak digestion and a weak digestive tract, prone to vomiting, prone to diarrhea, prone to skin problems. And so I always will put that on for this breed. His personality and constitution are the spleen. He's the earth element, which is the element of the spleen. So earth constitutions, again, are friendly, calm, kind of laid back, couch potatoes, not like the Pomeranians we talked about that are in your face and demanding attention all the time. These guys are just kind of content to hang out. So we have red and hot ears. So red is heat and hot is heat, obviously. There's probably a bit of swelling that goes along with that. So that's going to be damp. Remember, damp heat is itis or inflammation. The skin lesions are red, which is going to be heat. The itch is intense. I didn't really talk about itching and the intensity of itching like we talked about pain last time. A mild itch, so like that previous case, the blood deficiency itches are going to be more mild. The intense itching they're going to progress from kind of a moderate itch with damp to a more severe itch with damp heat. And then there's a deeper level that the heat can invade at the blood level, and that can be blood heat. So an intense itch is going to be a little bit more of a path of an excess condition from the itching rather than a deficiency condition with the blood deficiency. The fur is dry, again, blood deficiency, just like in the last case. The skin is greasy. So this one has dry fur with greasy skin instead of dry fur with mild flaking. So anything that's greasy, any kind of a discharge is probably going to be associated with the pathogenic factor of damp. Overweight and obesity is going to be damp. It's an accumulation of that pathologic fluid. And then we talked about that over time, that damp creates damp heat, that when chi tries to flow through the damp heat, it creates, or through the damp, it creates friction, which creates damp heat, which over time progresses into phlegm. Positive response to antibiotics and anti-inflammatory medications, again, damp heat. Worse in the hotter month, that tells me that there's probably an excess heat, and the heat is probably internal. He's lethargic in the heat, more active in cooler weather, again, damp and heat, and probably also a bit of chi deficiency. Loves to eat. There's that earth and spleen constitution and spleen deficiency. Processed kibble damages the spleen chi and generates all of those other things that we just talked about. Yeast is an indication of damp. And the breath odor is going to indicate heat. So heat, it could be stomach heat, or it could also be damp heat. And then the red, wet, swollen tongue. So the swollen, wet tongue is going to be the damp component, and then the red color is going to be heat. So this is kind of a really straightforward case, and I really liked this because if you look through here and you don't see damp and damp heat and damp heat and damp and damp and damp heat and put that on your list, then you're missing something. So this one is really easy. It's a very typical presentation for retrievers eating processed food. it damages their spleen qi. It creates, again, that same pattern of blood deficiency combined with the excess of damp heat and damp heat. So when we go on to make our final list, the Western diagnosis is otitis, which is ear infections, and bacterial dermatitis, again, itis, damp heat. The TCVM pattern that we are going to assign is spleen qi deficiency and damp heat. So commonly, you're going to see combinations of excess and deficiency with time. I also think that 2 additional patterns are blood deficiency and the excess of phlegm. And so what you see over time is the more that this kind of smolders and doesn't get resolved, that you start out with the spleen qi deficiency and damp heat. And if you look at this dog in 2 to 3 years, you're probably going to see more signs of the blood deficiency and phlegm. Does that make sense? Does anybody have any questions about this case? This is a really common thing that I see daily in clinical practice. So I don't know if you have seen it in your own pet or other pets, but you should be able to recognize it now, hopefully.
This is a much easier one to really, it's so straightforward with this guy.
Yeah, it is. It is. I thought that it was a really good example.
This was perfectly my German Shepherd. Yeah.
Did you see? Yep. Did you see the tongue on the German Shepherd from last week when we did the tongue diagnosis?
Yes.
That
yes.
lavender tongue. Yeah.
Interesting. Yes, exactly.
Okay.
Oh.
Yeah. Does anybody have any questions? Does anybody have any interest in going through your own case? Because I just brought 2 cases. If not, that's totally fine. We will start on the acupuncture section of this. I was going to say module, but it's a session. Does anybody have any questions about anything that they've seen in their own pet that you wanted to talk about? Maybe not go through the whole thing.
Oh.
There's also some handouts in the Google Drive. There's a table, I believe, in there that you can basically do what I just did. You can list all of your attributes of the case, and then you can go through the other documents on making a diagnosis and identifying patterns, and then make your column, in the right-hand column. I'm going to maintain a forum, probably do the email. And if you have a case that you want to share or you have questions about, then you can post it to the group email, and then we can maybe work through them that way too. So just, spend the next week or 2 kind of looking and seeing. And if you have questions about what you're seeing, or you want to go through a case that you've put together, I would love to do that with you. Okay.
Okay, quick question. Can
Yeah,
you hear me?
absolutely.
So when you were mentioning about the dogs who don't want to eat in the morning, and I've heard it called like old dog case, but what is it again? It's a spleen qi deficiency?
Yes. So
Okay.
they'll get, so they don't want to eat in the morning. Their appetite's poor. So poor appetite,
Yeah.
spleen qi deficiency. They can have coxcrow diarrhea, which is, first thing in the morning is diarrhea because spleen qi deficiency and damp. Sometimes they have what's called bilious vomiting, where they have little, like, kind of up a little bit of yellow bile. That's going to be more heat, but again, that all that damp comes from the spleen. So those are all things that could be stomach heat, but that's also going to be associated with the spleen qi deficiency.
Well, thanks.
Okay, absolutely. All right, so if there's any more questions, super. So we're going to move on. I promised you that we would learn a little bit about acupuncture because that is one of the sections of traditional Chinese medicine. It's just going to be kind of brief and basic and an overview and an introduction to acupuncture. So what is an acupuncture point? Excuse me. It's not a really unique structure in and of itself. There's nothing unique about an acupuncture point other than it is an aggregation of specific tissues. So there are nerve bundles in here. There's what's called afferent nerve. Afferent means towards. So there's a little nerve that comes in here up from the deep tissue. And I'll talk a little bit more about fascia in a moment. There are blood vessels, there's lymphatics, there's immune cells, mast cells, and then the surface of the acupuncture point is a little bit thinner and has a lower electrical resistance. And Brandy, I would love to do another talk on acupuncture. So we can definitely plan on that. So what happens when you stick a needle in an acupuncture point is you disrupt the collagen or the fascia, and that stimulates these mast cells. So, you know, when you take antihistamines, when you have a cold or an allergy, the antihistamines neutralize the histamine that's released from mast cells when they get stimulated. So mast cells are those cells that make your eyes water and your nose run, but they're also going to cause engorgement or swelling of this acupuncture point that puts pressure on all of these other structures and activates them to do all of these things. So I know there's a lot of words and there's a lot of big words. So the effects of acupuncture they can be complicated. We're really starting to learn more about acupuncture and how it works. But the way that it works for pain is, you know, if you stub your toe and it hurts and then you bite your finger, your toe doesn't hurt as much. So what happens when you have pain and chronic pain is the C fibers, which is one type of nerve fiber, they transmit their impulses slowly. And so over time and over chronic pain, they just continuously fire these slow impulses. But when you put an acupuncture needle in an acupuncture point, it's a sharp pain and the body's like, oh, there's a pain. And the A delta fibers are very fast. And so they actually go up into the spinal cord and they block the transmission from the slower C fibers. So it's called the gate theory, or they close the gate. So they prevent the body from recognizing those chronic pains signals. They also cause release of beta endorphins, and then noradrenaline, and then serotonin, one of the kind of feel-good neurotransmitters, are released from the brain. It also goes up and stimulates a certain area of the brain and then sends an inhibiting factor back down to the spinal cord. So it kind of inhibits the pain transmission that way from the brain as well. There's, excuse me, there's some compounds that are released, nitric oxide and CGRP, that regulate local and systemic blood flow. And the endocrine system, oxytocin, and this is like a steroid type of a hormone, are released from the pituitary gland. And then it also can stimulate the bone marrow to make more red and white blood cells. This one right here, the effect on the immune system, can be really beneficial when you're doing acupuncture post-chemotherapy treatment, when the anemia and the white blood cells drop. So I told you we'd talk a little bit about fascia, and I did borrow this, obviously, from the internet. There wasn't a reference for it, but I thought that it was kind of a good group of illustrations on what fascia is. So fascia it's a connective tissue, which is a fibrous type of a tissue, and it holds organs, muscles, blood vessels, nerve, and it's kind of like a net or a matrix throughout the whole body. And so one of the theories now is that acupuncture works through the fascial system, so that when you put an acupuncture needle in the skin right here, it transmits mediators, nitric oxide, and other compounds through the fascia to the remote areas of the body. And so it is a way that you can put a needle in the leg and stimulate an effect at a remote area of the body. So the fascial network is what's thought to be the explanation for the acupuncture channels. So the channels and meridians are also called Jing-Lo, are strings of acupuncture points, and we'll go over those next. And they are all connected and thought to be in the fascial network. The body's fascial network, again, is the physical substrate that is represented by the meridians or the channels. So this is a screenshot or a picture of a book by Christina Mattern. Here's the reference for that. And it's the course textbook for the acupuncture courses for College of Integrative Veterinary Therapies. And this one is really, I thought, nice because it shows kind of an illustration of the channels. We talked on the horary clock a while back that the chi starts in the lung meridian, kind of comes down here, goes to the large intestine meridian, and then it circulates back here to the stomach and the spleen meridian. And so these are the avenues that the chi flows through in the body on a daily basis. And this is more of an illustration of the top part of the body and then the bottom part of the body. And the cool thing about this is these are all the urinary bladder meridian points on the back, and they're sequentially numbered, and they correspond to different spinal segments here on the body. And the thing that I really appreciate is that if you think of where the internal organs are, the lung is up here, the heart is here in the chest, you've got the diaphragm down here with the liver and the gallbladder and the spleen and the stomach sitting right behind it. The triple heater, again, is not a physical organ, and the back shoe point sits right in front of the kidney back shoe point. If you think the kidneys sit right here, right under where this is, and then the large intestine and the small intestine and the urinary bladder. So just knowing these points and being able to count the spinal cord segments, you can put needles in these bladder points that have a direct connection through the spinal cord with the internal organs. And that's one of the ways that putting a needle in externally can communicate with and affect the blood flow of the internal organs. So those are the association points or the back shoe points. Now, if you look at the bottom of the body, so here's the sternum and the xiphoid here and the ribs, there are also conception vessel points on the midline here that have actions that are important for the internal organs as well. I'm not going to really talk about these other ones, but I am going to touch on one of the conception vessel points. So I thought that this was a really good diagram of the governing vessel and the conception vessel. I had a hard time finding a picture of conception vessel 17. This is the conception vessel point that I wanted to talk about. And I found it on a picture for acupoints for brachycephalic dogs. And I thought that it was interesting because when I was looking for this point, this is a point that I talk to clients about a lot for reverse sneezing. So reverse sneezing can be thought of, you've got phlegm component, you've got the lung that opens to the nose and the nasopharynx. And so when you have a reverse sneezing and that, kind of gasping, trying to get like postnasal drip or whatever they're trying to relieve, that is chi stagnation in the head, and it's associated with the lungs. So because it's the nose. So what I tell clients is to gently stroke the neck from the chin down to stop at conception vessel 17. And so conception vessel 17, the way I find it is I run my hand from the manubrium, the top of the breastbone in the front of the body here, and I run it down and end up between the front legs. And there's usually a pretty significant or palpable depression there. And that's where conception vessel 17 is. If you're really good at counting ribs, it's at the level of the fourth rib in the fourth intercostal space. but it's easy for me, and I think for you too, just to kind of slide your fingers down under the chest, and it's right in between the front legs. So conception vessel 17 is useful also because it's good for any coughing or chest problems, and it's also a calming point. And so I find, and clients have told me that when they do that, when we used to use Benadryl to calm them, but if they just stroke and they end up at conception vessel 17, and you can actually put pressure on it or do some massage, which is what this text actually describes, is it's going to redirect that lung qi down, and it's going to be calming. And a big part of relieving reverse sneezing is to calm them. This is another point that I like a lot. It's called gallbladder 21. And if the head is to the right here, and this right here is the shoulder blade. So if you find the top of the shoulder blade and the point of the shoulder, halfway in between the top and the shoulder, right in front of the shoulder blade, is gallbladder 21. I find that a lot of animals really like massage. You can kind of do this over from the top of their neck, or you can just kind of massage it, one at a time. But it is a really good point, and the animals seem to tolerate it and enjoy it. It regulates qi and reduces phlegm. It's a good point for the neck and the shoulder. I did find in the description of the point and the point actions that it's contraindicated with pregnancy. So some of the points, and I'm not going to show you a lot of points that have significant contraindications, but you do need to kind of be aware that some acupuncture points will stimulate uterine contractions. And even though I don't see a lot of pregnancies, because I don't do reproductive medicine, having contraindications for different medical conditions is something that you need to know. But this is a really good one. My cats love to have these points massaged. So the next pair of points is going to be bladder 60 and kidney 3. Bladder 60, so because animals walk kind of more upright, humans have more of a right angle here. So this is going to be our ankle. And this right here is going to be our heel. And then this bone right here, the two bones on the inside and outside of our ankle, that's what these are. They're called the malleolus. And so in between this bone and the point of the hock, or the heel, I guess, if you will, is a web of skin. And there's really nothing there. It's just skin. And on the outside, the lateral side, is a point called bladder 60. It's also called the aspirin point, and this point relieves pain everywhere in the body. Directly opposite that, and I used this dog here because it actually has both bladder 60 over here on the outside, but on the inside, directly opposite bladder 60, is kidney 3. So kidney 3 is, in Chinese medicine, the kidney governs the hind end, it governs the bones, it governs the marrow, which is the brain and the spinal cord. And so tonifying the kidney 3 acupuncture point, or massaging it, or acupressure, can help a lot with hind end weakness and pain. It supports the kidney and strengthens the lower back and the knees. Now, if you notice here, just to reemphasize, when I put kidney, I put the small k. So that means I'm talking about the actual organ. But over here, the K is capitalized. So that's the Chinese medicine kidney. Okay, so these are two easy points. Again, you can just grab the back of the hock and just kind of squeeze and apply acupressure or do a little massage. And you're going to help with these animals that have hind end weakness, a painful hind end, painful lower back and knees, and also afford some analgesia and some pain relief. Stomach 36, I think stomach 36 I saw somewhere is Neil's favorite point. It is on the hind leg, and I made the location of the points in this slide yellow rather than red because this dog here was under general anesthesia, and this is an EKG lead, which has a red dot on it, so I didn't want to get that confused with where the acupuncture point is. So on the hind leg, on the knee, you're going to have the kneecap. And then you have this bony prominence. And if you feel your own leg, that's going to be like right below the knee, right in front. And if you flex your foot with your hand or your fingers on that bony prominence and you flex your foot, you have a muscle that kind of pops up to the outside, the lateral side of your shin bone. And that's your cranial tibial muscle. And in the middle of that cranial tibial muscle is where stomach 36 is. So stomach 36 is a point that's a little bit different because it's not actually in between muscles. It is around a joint, but this one is actually in the belly of the muscle. This point is useful for so many things. It's the master point for the cranial abdomen. So any vomiting, any diarrhea, pancreatitis, anything like that, it is a really useful point. It tonifies chi and blood. It's a great point for deficient patients. Also, by virtue of the fact that it's at the knee, a lot of these acupuncture points around the knee are good for draining damp heat or treating inflammation. So it's not only useful for deficiencies, but you can also use it for the excess damp and heat. It's a calming point, and it nourishes source chi or wan chi, your jing, blood and yin. So everybody almost could use this point. It's a great acupuncture point. And so what you would do to do acupressure here is you could press on the muscle right here. You could actually even massage up and down this muscle because there's a string of points on the stomach meridian 36, 37, 38, 39 that all have real similar actions. And so you can just massage that muscle right there and really do a lot of benefit. And then this is a Sphinx cat. I just kind of a different perspective. Again, here's the knee, here's the bony prominence. This is where the kneecap attaches, and stomach 36 is here in the belly of that muscle. And then this is the last point. This point's really easy to find. It's called bladder 40. It's at the back of the knee. So if you flex your pet's hind leg, there's usually a big hole or a depression right behind the knee. Just stick your thumb right in that, and that's bladder 40. That is the master point for the lower back and the hip. Again, by virtue of the fact that it's around the knee, it's going to clear heat and damp, so it helps with inflammation. It's also a really good point for pain relief, the blood stasis pain, the more severe pain, and it also relaxes the tendons. So it's a point that I use almost all the time. It's easy to find, but a lot of my patients are hind end weakness, hip pain, knee pain, and arthritis in the lower back. And this is a really, really good point for all of that. It's also useful for dermatitis as well, again, because it drains damp and clears heat. So just to summarize now, we have learned different TCVM theories, the 8 principles, Zong Fu, 5 element theory. We had a real good discussion about yin and yang and qi. We looked at the fundamental substances and the 6 evils, and then we followed up at the beginning of this session tonight with the horary clock. We looked at how to use the 4 examinations, our senses of listening, smelling, touching, and observing, combined with tongue diagnosis and our 10 questions to flesh out our Western problem list and add in information that's useful to help us identify a TCVM pattern. So this again, we just did an introduction to acupuncture this time. We looked at what is an acupuncture point, how it affects the body, had a brief look at the channel theory and fascia, and then we looked at 6 useful acupressure points. And again, this was just an introduction, but I wanted to kind of dip our toes into acupuncture because it is part of Chinese medicine, in addition to food therapy and Qigong and Tai Chi and Tuina massage. So that is all that I have for you guys. Again, here is the link for the folder with all of the handouts. I put some of the handouts from the previous 2 sessions in here also, just so that you'd have it all in one place. It should have all of the documents for this session. And then another couple things that I wanted to ask is, I would like to have some feedback on the presentations. There's 2 feedback documents in there. One of them is a table, and it is from Fortress Learning, and it's specific for my training assessment and the class for certification in teaching and assessing. So if you would fill that out and email that back to me, I would really appreciate it. When you email it back to me, make sure to email it just to me and don't do a group reply, because I'd prefer that the feedback be a little, confidential, if you will. And then I have a personal feedback form in there with some other things for me, just to make sure that I grow and that I learn in my teaching. What are my slides? Are they effective? Is my background distracting? What can I do different? What did you like? What did you not like? What suggestions that you have? I'm really kind of open to anything. So if you would give me some feedback in the next week, that would be really appreciated. And that is it for me for tonight. If anyone has any questions or has anything that they want to continue to discuss, I'm definitely open.
Are you planning on doing any more acupuncture and food therapy, more in-depth lessons on those 2?
I certainly can. I'm going to stop sharing my screen here so that I can see everybody. I can. As far as my certification assessment, I just needed to do 3. So I made a group that was cohesive and a little limited because there's so much. But I can certainly do a food therapy, like you asked last time, talk about colors and how they're associated with the organs and that, and definitely go more in depth into acupuncture. I probably won't do Tuina massage and Qigong and Tai Chi, but I can definitely cover those other 2 areas for you.
That would be wonderful. And just to help tie it all in together as a whole, more whole piece.
Mhm.
So Jody,
Yes.
when you've submitted your assignment, this is without feedback from the learners. I haven't had a look at your assignment yet. Or did you get feedback from the first 2?
No,
So
I have not had feedback yet. I just put that in tonight because they're all connected.
yes, they
And
are.
so I wanted feedback at the end.
So maybe we could get some verbal feedback just from people about it overall, so that I can hear the feedback, because then how could I say that? Because you've also then, I haven't had a look at the end of your assignment either. You haven't done a review on your feedback. Is that correct? A reflection?
Correct.
All right, cool. That's okay. But I'd love to hear everybody's feedback online, because that's really interesting. And when you do give Jody feedback, you need to, like, sounds terrible, but be honest, because she really would like to know what she could do better. I mean, it's all, and I actually thought you were really fantastic, to be honest. And it's so, as an ex-nurse of adults, I find it really, really fascinating what you're teaching and how you've taught it. And I would love to know more about the acupuncture too. Not that I'll ever teach it, but it's really fascinating how it works. But be honest and open with her. Tell her what, maybe not, and I know you want more, but is there anything, her style, her slides, anything that she could improve upon, so she can reflect, so next time she teaches it to whomever, she can make adjustments that way. Is that okay? Can we just, anybody like to give some verbal feedback, please? So I can hear it too. I'd love to mark her as all, done and dusted just about. Oh, and you've got, you're on mute, please.
Unmute. Okay. I always love learning from Jody. Absolutely. And these sessions have been no different. I think you have an incredible amount of information, and I think you do a beautiful job of scaling it down, because I know there's so much involved, and how you've been able to scale it down in such to be able to fit into an hour. I will never know. I don't know how you did it, but yeah, I think you did a beautiful job. The only thing that I would say is I would love for your background to be more like plants or animals, or like the, you know, the charts, you know, from the Chians, like that type of thing, just because it fits more with you and what it is that you're bringing to the table for all of us in these sessions. It just speaks to you more and who you are and your whole methodology behind not just how you work, but how you live.
That's really nice. That's lovely. Anybody else?
I was going to say that I'm pretty lucky because I get to work with her on a daily basis. So I get to hear a lot of what she teaches and tells to the clients. And TCM and acupuncture is very complex, and I'm still learning it a year and a half in, but she does a really good job of dumbing it down and putting it into a perspective where you can understand it. And that's not only in practice, but I definitely think during all of these sessions, she's been able to do that and clarify it and make it in a simple term, even though it is definitely not simple, which has been really, really helpful. Because a lot of times I have to digest that and be able to understand it so that I can answer questions for the clients. And so that's been really helpful. I agree with Lee that it's a lot of information to pack into 3 hours or in 1 hour segments. And so she did a really good job about finding diagrams and pinpointing the acupuncture points in ways that you can find them and understand them and kind of almost try and put it in your own perspective. I think that the 4 exams and the 10 questions and the way she broke it down was really, really easy to digest and understand and utilize in a daily way, which I credit her for that. My only 2 learning points were when she forgot to turn on the camera during the first one, and then same thing, the background. I think it would be good to have, like she said, some kind of teaching background or calming background. I know a lot of times we put on like walking into forest paths and stuff like that, something like that, that little less distracting might be good.
Brandy, can I say something to that? It's the death of all trainers and assessors or anybody trying to teach of the electronics that go wrong at the start of everything. If it's going to happen, it's going to happen at the worst of times when your teachers, trainers, when the people who are assessing you are watching. And it's how you come back from that and move on from that is the sign that you're doing really well, because it happens to all of us. It happens to me all the time. Right? There's no electricity, or one night I actually went down, my whole power and internet went off during a class. So the class ended up going, and weirdly enough, and I say weirdly enough, I'd only actually said about an hour early, if something ever happens, just keep going and complete your work. And they all did together. So there you go. I couldn't even get back to them. I had to ring them to tell them. So I think that's a testament of resilience and being able to move forward without sort of going, oh my goodness, you know, like that's all gone wrong, because it doesn't go wrong. It shows what a good presenter she is to come back from those things. Laurie was going to say something.
Yeah. I'm an outsider. I'm the example of the pet owner who would come in. I've had a little orientation with like Ayurveda and Chinese medicine, TCM, in the past. So I loved this. It was power packed. I would sign up for one of your classes and I would expect it to take 3 to 6 months at the minimum. Because this was so packed with great information. In terms of my ability to follow along as somebody coming in from the outside, I would say last weekend, I was able to follow along with the paperwork, having printed it out. Today I had a little more of a struggle. It's a minor thing, but maybe something about the having once it's printed out, having the page numbers organized. I didn't go through it ahead of time well enough, so I could put that on myself. But so it's a very minor thing. That would have helped me a little. But I can definitely say the cross-referencing of information, seeing it in different forms is excellent. And I too will definitely use this. I do more energy medicine and with people more, but some people's pets. And I will definitely come back to this material. I loved it. I would love more.
Thank you.
Give us more.
Thank you.
Anybody else? Hello, Neil. Nice to meet you, sir. It's been a while since we spoke. We can't hear you for some reason, Neil, even though you're on. Maybe it's your microphone. Could be your headphones. We have a problem. Houston, we have a problem.
I think it said that you're muted.
No, he's not muted. It's his.
How about now?
That's
There you
much
go.
better.
There we go. Sorry about that. Hi, Deb.
Hello. What's
Jody,
your-
I think you did great. There was really good information presented. I would love to have my veterinary assistants listen to these. As Brandy said, it would be really good for someone who had to come in and logically explain what's happening in a veterinary practice that does this sort of medicine. So I thought the organization was great. I thought your slides were wonderful. The graphics were really good. There wasn't too much information on the slides, which we tend to see in these sort of veterinary presentations. And something that no one else has mentioned, but I will because it's a pet peeve, is your sound was great. You know, people try to get away with using cheap microphones in their computer, or, you know, it's just something really basic that a lot of people overlook, is to make sure that their sound is good. And yours was great. So I really appreciated that too.
Thank you.
Anybody else? Lovely. Oh, awesome. I actually agree. I just think that the way we call it, if you want to call it, dumbed it down, is I was excited. I'm going, can I just ask a question? Do you I notice you use pressure points on animals. Do you actually get to use the needles with animals if they'll, is it, or if they allow you, or you just use more acupressure than acupuncture?
No, I practice acupuncture. So
Oh,
I mean, I've used acupressure in clinical practice on patients who don't like needles. So, you know, you can use a laser on the acupuncture points, or you can do acupressure. But I pretty much almost always use needles. You can't do that at home because in California you have to be a veterinarian. It's a veterinary procedure, so you have to be a veterinarian. But acupressure, there's actually, Brandy, do you have that book, 4 Paws, 5 Directions? So this book here, I didn't mention it enough. This is a book that is really good for lay people and clients. So Lori, that might be a book that you could use and appreciate. It's written by Cheryl Schwartz. Thanks, Brandy. And it's a really great, like a layperson pet owner's book. And I tend to give it out, and I think I've bought like 3 or 4 because people don't bring it back, I'm assuming because they like it. But that book talks about foods and acupressure and a lot of other things and treating different organ systems. So I use needles.
Lovely.
Yeah. Well, I'm gonna say, and I love the examples that we were doing. That helped a lot to apply the patterns to what's going on. So even last week, there was so much dense information, but it would be nice to also have like, okay, this is like, and you did mention it earlier about high cholesterol, and like just giving really clear examples of, oh, when you have the triple burner, this is what's going on. But everything else was great. I mean, it was so much information. I definitely have to watch it again to to go through and catch everything.
Thanks. I'm gonna have an email thread that we can use for the next couple weeks to talk about cases and to follow up. I think I had put in my original write-up that I was gonna have a forum. I'm not sure how to do that. If there's a place that I can make a forum that we could use, I'll work on that.
I have a question. So like Lori, I am not in the industry. And actually I'm a client of Mary's. She referred me. So I'm here just because I care about my companions. So I'm also coming from the outside, not in the, like I said, not in the industry. Do have an interest. And I did my homework. I will say in terms of feedback, the information from last week, it was also a lot. And I think I was kind of like what Lori said, I was also a little bit lost in today's call. But again, I'm coming from the layperson perspective. So I think I started to get the pieces together, like, oh, so like when you were talking about this, by the time you got to the second example, I was going back and forth between like listening to you, watching your slides, and also going back like, okay, where were those notes from last week? And then I was kind of like putting it together, but it took me a little bit. And where I'm going with this is, because you gave us a homework assignment, I did some notes, and Mary knows I have multiple munchkins, and I'm like, okay, guys, show me your tongue. So I'm like, show me your tongue, guys. And I actually was able to get 3 out of 4. Ironically, the one I really wanted to get, he did not want to show me his tongue. But I actually did my homework. I followed the questionnaire, and I even put a picture of each of the ones. So I actually have 3 Word documents. My question now is, do you want us to upload anything to, like, can we upload it to the Google Drive? And then that way we can share and see, like, like examples. And then the other point is, again, going back to the layperson perspective, I didn't realize from the homework assignment that I should have also done like the assessment, which I think that's the part that I was not getting, so I didn't put all the pieces together with the notes. Also take that with a grain of salt. I mean, again, I'm not in the industry, so it wasn't like I was looking at your notes intently in preparation for today's class.
Maybe what I could do is make a folder in the Google Docs that everybody can share.
Ooh.
And then we can go through cases and comment on them. Would that work? Okay.
Oh, that'd be great.
Okay.
That's really good. That's a really good feedback, because the other thing too is this program is designed for veterinary nurses, isn't it, Jody, from memory, or for people that are in the industry?
Pet
So if
parents and nurses.
Yeah, pet parents. So I mean, if you've gotten this far and you've got some understanding, she's done a really good job. Because I'm a registered nurse, so the names of fascias and it was just, I find it fascinating, fascias, but I found it fascinating. But you're right, if you're coming from a non-medical point of view and you've actually been able to understand and go that far, that's wonderful. Isn't that great?
It's
Well done,
fascinating.
Jody. Well done,
Thank you.
Jody.
Thanks.
Oh,
All right, so I'm going to stop the recording.